Hi everyone, I am Elaine Q. Hermoso from BSP 2-4. In today's video, we're going to talk about the genitopelvic pain or penetration disorder. So, the concept of genitopelvic pain and penetration disorder, they don't exactly fit into the specific phases of the sexual response cycle, but they do cause both physical and psychological distress. And this term, genitopelvic pain and penetration disorder, or GPPPD, and what the DSM-5 did was it collapsed the terms vaginismus and dysphorunia. These two conditions affects one's ability to have intimacy without pain. Vaginismus would be the involuntary spasms of the musculature surrounding the vagina area. Dysphorunia is more of a pelvic pain either during or after sexual intercourse. Now, to meet the criteria for GPPPD, you need to have this condition for 6 months or longer, with persistent and recurrent difficulties in one or more of the following: vaginal penetration, vulvovaginal or pelvic pain during intercourse or penetration attempts, fear, anxiety about vulvovaginal or pelvic pain in anticipation of sexual intercourse, tensing or tightening of the pelvic floor muscles during or in an attempt for vaginal penetration. In these features, at least one of them have to be present for most if not all sexual experiences for 6 months. Based on my research, it says that it has to be persistent or recurring because periodically there is going to be pain during sexual intercourse, and that could be due to a whole host of factors, whether it be forcefulness of the act, whether it be the girth of the penis. This condition also has to cause some form of psychological distress, and it has to be interfere with some aspects of functions, usually romantic intimacy, so it sometimes causes relationship problems. Vaginismus, as I said, was the involuntary contraction of the muscles on the outer third of the vagina, and this condition doesn't have much research as other issues, but we can estimate that less than 1% of women experience this issue. Most people view vaginismus as a learned fear response, so cognitive behavioral therapy could be used in this regard. Some people might experience vaginismus as a function of some kind of infections or disease, and many people with vaginismus have other sexual disorders and psychological disorders like panic disorder. Dysphorunia is characterized by pain in the genitals during sexual activity. We know that roughly 14% of women and about 3% of men suffer from this condition. So, this is almost 5 times more common in women. Now, a typical physical cause could be some tearing or injury during childbirth, but there are psychological factors such as relationship and psychosocial problems that could contribute to this. Let's try to understand some health conditions that could result in genital pain, such as endometriosis, pelvic inflammatory disease, interstitial cystitis, pelvic floor dysfunction, and uterine fibroid. So, these are all medical conditions that can cause pain during sexual intercourse and create some anxieties about having sexual intercourse. So now, let's talk about treatments. There are some treatments we mentioned that vaginismus is the involuntary contraction or tightening of the vaginal muscle, thus closing the vaginal canal. We can use exercises such as Kegel exercises, using a yoni egg, which are practicing or teaching a person how to tighten and release the muscles of the vagina. And 90 of people or most women return to a pain-free sexual experience. With dysphorunia, it's a lot harder to treat because many times, unlike vaginismus, which has clear psychological anxiety factor or learned fear response, dysphorunia. So that is a very brief explanation for the concept of genitopelvic pain and penetration disorder. Thank you for watching and God bless.